All right, good morning, everyone. And good morning, everyone on Zoom. And hopefully we don't have any technological glitches, and hopefully you can hear me with the mask. I feel relatively comfortable taking the mask off with this distance away from you. If you can't hear me, but if you can, I prefer to keep it on. It's okay. My name is Darren Cousineau. I'm the District Director of Environmental Health and Safety, Environmental Health and Risk Management. Sorry, they changed my title. And today we're going to spend a little bit of time going over some COVID-19 safety protocols in the classroom, spend a little time talking about how the information gets disseminated from the top downward, talk about some of the emerging information about the Delta variant and how it may apply to us. And then, of course, we'll have, I'm sure, a very lengthy question and answer session. Just a little bit about myself. I've been with the district for 15 years now, and I had the pleasure of being able to present yesterday in the convocation. I haven't done that in almost 14 years, and so that was nice, and it's really nice to see everyone. It's nice to see you all here as well. It's nice to see people in real life. My background's in public health and environmental health science, and I'm a registered environmental health specialist with the state of California. I've been practicing environmental health for 27 years now. And I can tell you that even though I've had a background in communicable diseases, epidemiology, and things of that nature, I would never in my lifetime believe that we would be here talking about this right now. So interesting times. I know that we're going to have a robust question and answer session. Please know that I will be able to answer many of the questions. My colleague, Keith Ford, who I'll introduce here in just a moment, will also be helping to answer those questions. And just know that some questions aren't answerable. So I just beg for some patience on some of the questions. And with that, I'd like to just step aside here and allow Keith to introduce himself.
Okay. How do you tell if you're visible on the screen? Is that, oh, anyway. So, well, good morning. Thank you, Darren. And thank you so much for taking the time to come out to Fresno City College. This was a major victory for us, right? To get the face-to-face meeting for those of us who are teaching face-to-face this fall, and to get the head of this COVID response to come out to speak to us. So I'm Keith Ford. Most of you know me. Some of you have known me a long time, like from babies growing phase. So I'm the president of State Center Federation of Teachers. Been in that role for, I think this is my 4th year. We also have other union representatives in the room today. We have Paul Gilmore, the executive vice president, and Mark Trezza, who was VP of grievance before and now is an at-large rep. Both wonderful, wonderful resources to have. And like Darren said, we'll have a robust Q&A. The idea is for Darren to share his expertise, and any question that he can't answer, I'll try. And any question that I can't answer, he'll try. Do be advised, as he said, the regulations change every day. This is, you know, it goes bad quicker than tree fruit, right? So we're doing our best, and if we can't answer, what I promise you is that we will follow up and get an answer for you. So thank you all for being here. Thanks to the Zoom folks. I hope everybody can hear me. I'm using my teacher voice, but it's a little rusty. So all right, let's go ahead and get started.
All right. Thank you, Keith. I really appreciate that. So the first thing I'd like to do is just spend a little bit of time. Oops, my slides aren't forwarding again. One moment, a little tech issue. Okay, try that. Okay, what I'd like to spend a little bit of, just briefly, a little bit of time on how these guidances and mandates are passed on from the top down. And so when we have a new public health guidance that comes from the CDC, most typically, occasionally the FDA, but typically the CDC with respect to COVID-19, and CDC disseminates that information to the state public health departments. In our case, it's the California Department of Public Health, or CDPH. CDPH then coordinates with Cal OSHA, who has an emergency regulation in place for COVID-19 prevention. And they coordinate with our local health departments. In our case in Fresno, is Fresno County Department of Public Health and Director David Lucchini. There's also sort of a process that gets a little bit muddled. We have enacted legislation that requires HR, myself, to have to perform certain notification requirements. And then, of course, we have the Chancellor's emergency order. And in fact, you just saw an update of the Chancellor's emergency order on face mask wearing last Friday. And that's why we're all wearing face masks again inside. And we'll spend a little bit of time talking about that in just a moment. So what are the established safety protocols that we have in place currently? As you know, the most recent mask mandate, we had a mask mandate just as of 6 weeks ago, right? Now we're back into it again. Social distancing is recommended. It's not a mandate right now. That may very well change depending on the basically the data that we see on the ground. But that was a mandate just a few weeks ago, and then it went away, and it may come back again. That's the reason I left it on here. We have a requirement to to perform a self-health screen. And what that means is just don't show up to work if you're ill. Get a hold of your manager. We don't want people, whether it's a student aide, a staff or faculty member coming to work if they're ill. And then, of course, we have increased hand sanitizing stations, wash stations throughout our campus. And you see them everywhere if you've been around campus. They're quite prevalent. We've provided enhanced sanitation. Our building services folks, who've been doing just yeoman's work during this last several months, are providing a comprehensive sanitization of all classrooms and work areas at least once a day. And then they're also providing sanitary wipes or napkins with a disinfectant spray for those who wish to enhance, again, their sanitation. Now, we know through learning about this coronavirus over the last 16, 18 months, that the primary method of transmission is through respiratory aerosols. And that's why we're wearing the masks. And a very, very minor transmission mode is through fomites or touching surfaces that are infected. But that being said, there's a ton of things that can get you sick that are on surfaces, not just COVID-19. And so the whole idea is we want to keep our workplace safe. We want to keep our employees safe from any disease. And so we do want to have enhanced sanitation of frequently touched items, and our building services folks are doing that. And then finally, this is a question I get a lot. We know that being outside is safer than being inside. So what we try to do is create the inside environment to mimic the outside environment the best we can through modification of our HVAC systems, our ventilation systems. What our maintenance crew has done is they've maximized the fresh air intake on all of our air handlers district-wide, not just this campus, for those of you who teach at other campuses. But we have made adjustments to them to bring in more fresh air to the maximum extent that they can and still operate in a comfortable manner and without damaging our equipment. So just know that we have multiple types of HVAC systems on this campus. This building, for example, is run by giant air handlers that are in the basement. Some have package units like you might have on a residential home on top of a building, but all of them have the ability to adjust how much fresh air comes in, and that's been done. I put this slide in here because just literally five weeks ago, the governor announced that we are going to scrap the blueprint for California's safe reopening and move towards something called Beyond the Blueprint. And as you know, the tier system was scrapped. At the time, it was no mask for vaccinated. Now it's recommended inside that all people wear a mask, and that's why we have our mask mandate. Again, this applies to us, but this applies to businesses too. Masks required for all non-vaccinated people inside. And then, of course, I mentioned that the mask for all inside for district buildings. And then finally, this is super important, and we've had a hard time collecting this information, but it's so valuable for our human resources folks. We really need to have our employees attest as to their vaccine status. And the link is right there, and it's on the single sign-in portal. When you log in, you'll see it, a very prominent, not a button, but a login area where you can enter in your information. For example, what was your first date of your vaccine? If you're vaccinated, what was your second date? And that way, our HR knows how to handle circumstances when somebody tests positive and somebody's around somebody else, because our protocols are different. And I'll go over a little bit of that as I proceed through the presentation. By the way, the presentation is fairly brief because we really want to emphasize the ability for you to have interaction with us, okay? I felt compelled to put some information about the Delta variant. You've been reading about the Delta variant. The Delta variant is really, it's a new development for our country. It's been impacting us pretty hard the last 3 to 4 weeks. And in fact, what the concern is it's about people being infected and going to the hospital. Our hospital system is not in crisis yet, but the number of positive patients within Fresno County has increased by 71% in 1 week. And if you look at that on a logarithmic curve, it is a logarithmic curve, and cases are really jumping up. And what we know about this actually is a little bit dated. When I wrote this, it says at least 50% more contagious than the original Alpha variant. It's actually more like 65, 70, maybe 70, up to 70% more contagious. We look at something called the knot number, and the original variant had a knot number of 2, meaning that for every person that was infected, it would be expected that that infected person might transmit that virus to two additional people. The COVID variant has a knot number of 7 to 8. So for every one person that's been infected, 7 to 8 more people will likely be infected by this variant, particularly if they're not vaccinated. I'll spend a little more time on that as well. It's unclear whether or not the Delta variant is more deadly in terms of for an individual's risk of dying. It looks like it could be. Information I'm seeing is the evidence is maybe trending towards it might be a little more deadly. But I can tell you it's deadly, more deadly in the sense that more people are being hospitalized, more people are being sickened by it, and more people are dying from it, and because there's just so many people, more people infected, if that makes sense. This particular variant, we've seen this said in the news, but it really is true. It is the pandemic of the unvaccinated. The people who are getting sick, the people who are being hospitalized, and for the most part, the people who are being infected are those who are not been vaccinated. Now, you hear about breakthrough infections, and I could spend a little time talking about that. I think, frankly, it's maybe a little more sensationalized. It's important, but it's a little bit more sensationalized, where the emphasis, really, the story here is that people need to get their vaccine. That's really the primary thing. So a little bit about the current vaccines. This particularly applies to the Pfizer and Moderna messenger RNA vaccines. It applies to the Johnson & Johnson vaccine in terms of severe illness and hospitalization, but all the vaccines that are in the market right now, the Johnson & Johnson, the Moderna, the Pfizer, are all extremely effective at preventing hospitalization and severe illness. And that's super important. When we had the Alpha variant, the original variant, the vaccines provided super high protection against actual infection and the ability for somebody that may have been exposed to the virus, but their antibodies neutralized it from spreading to somebody else. That's not necessarily the case anymore. We know now that somebody who's been fully vaccinated, they get infected, they're asymptomatic, they can spread it to other people. And that's the primary reason why we're wearing masks again inside, because masks have shown to be about 30 to 40% effective in reducing transmission rates. The fourth bullet there, 99.9% of deaths are happening in the unvaccinated population. That's a stark number. And if that doesn't provide evidence of how, frankly, miraculous these vaccines are, it should. And this is why we've been pushing it so hard for us to be vaccinated so that we can come back safely and be around each other. I know it's a controversial issue for some people. And I mentioned this in the convocation, I'll reiterate it here. I've had people come to me and say, I don't want to take the vaccine because I don't want to be part of an experiment. And my response to them is, you're already part of the experiment. You're the control group now. We've had almost 2/3 of the country fully vaccinated. The ones who are not being vaccinated are the control group, and we're seeing what's happening to them. And then what about booster shots? Every day I see more information about there will be a need for booster shots. Moderna came out today saying they anticipate a need for booster shots by early winter. So I can fully expect, Pfizer has said the same. San Francisco General Hospital is actually offering booster shots for people who have received the Johnson & Johnson vaccine. I see that on the horizon. If you asked me a week ago, I wouldn't be sure, but I really think the trend is going that way.
Before you move away from the variants, we had a question in the chat about the Lambda variant. Could you just let us know what you know about that so far?
Yes, there's a question in the chat about the Lambda variant. The Lambda variant is in our country. There's approximately, as of yesterday that I read, about 1,000 cases of infections caused by the Lambda variant. There is some concern that the existing vaccines are not going to be as effective against the Lambda variant, in the same manner that there was concerns that the existing vaccines wouldn't be effective with the Delta variant. We have a lot to learn about this, and I don't really know whether or not it's going to be more or less effective or not. Stay tuned. This subject moves fast. You know, we have to pivot, we have to be flexible, and we're going to be learning more about this, I'm sure, in the very, very near term. This is a really interesting chart. I mean, you don't need to see the numbers. I will just kind of explain it. But what this is a chart that identifies the number of people who are receiving breakthrough cases versus the number of people who are receiving infection based on vaccine. So on the far left of the chart is just, it goes by state. I just did a little snippet, so I don't have all the states here, but California is the fourth one down. And then the middle column is the column for vaccinated people. So in California, as of this data is current as of yesterday. I'm sorry, the day before yesterday. In California, we've had, out of all the people that have been vaccinated, a breakthrough rate of 1.4%. Now, if you remember early on with the vaccines were considered to be approximately 95% effective at preventing illness from COVID-19. And these numbers bear that out. There may be actually a little bit better. Hopefully that trend stays the same, but it's remarkable when you have the vaccinated population hardly ever getting infected. And then you look to the third column on the right, those are the people that are unvaccinated, and that's their infection rate. In California, 98.6 people have been infected who have not been vaccinated. So again, it's just, again, to say, I reiterate this because it shows the power of and effectiveness of the current vaccines that we have. Trends, masking, of course, masking, we keep bringing that up. We're seeing a trend of businesses requiring proof of vaccines. We have a couple bars in the Dower District that are already requiring evidence of your vaccine. I would encourage you, I see this as a trend as more and more businesses that don't want to have outbreaks, that don't want to have to deal with the hassle of the reporting requirements that we have to do. I really see the trend being for many businesses requiring a vaccine proof. And you can go to the state of California CDPH website, and if you have been fully vaccinated, you can get an electronic version of your vaccine, and it can be, mine is uploaded on Apple Pay. I'm not sure how mine is on Android Pay or Google Pay. I'm not sure how it works on Apple, but it gives me basically the details from the state of California on my vaccine. So I've got it portable with me. I don't have to carry my card, and it's just convenient. So I encourage everybody to do that because I think the writing's on the wall. We're going to see more of this.
What was the website again for that?
It's California Department of Public Health, cdph.ca.gov. And I may have to follow up on the exact site. So, another question?
No, one posted the exact site.
Oh, perfect. Thank you, whoever posted that. Appreciate that. And then the other trend that we're seeing is vaccine. Vaccine mandates are on the rise for many institutions. We've seen Google, we've seen Apple, we've seen the entire California hospital field. That's Valley Children's, St. Agnes in our area, Community Regional. They are all requiring and mandating vaccines. California State University, Fresno State, the UC. Many of these people were saying, we will mandate it once it's received full authorization from the FDA, not just emergency use authorization. Well, the courts have found in the favor of employers, regardless of whether it's been fully authorized or not. So our district is not there yet. Our chancellor kind of wants to take a wait and see approach and make decisions based on the data we see within our district and the guidance that we receive from our public health partners at the Fresno County Department of Public Health. We have a ton of resources that I'd like to just refer you to. It's on the Fresno City College website. In fact, it's on every college website, including the district website. So if you do, again, work at different sites, the information's all the same. But if you see right here, it says coronavirus resources. You click that and it'll provide you with all the guidance that's been, it provides you with all the guidance that's been released to date. Very good information. Before we go on to questions, I'd like to spend just a little bit of time talking about what a positive infection would look like in your classroom. There are two scenarios. We have a scenario where you as an instructor or you as a classified employee tell your manager, hey, I tested positive for coronavirus. At that point, the manager contacts HR. HR reaches out to the employee and gathers information from the employee and then provides the employee with information on their self-isolation requirements and when they might be able to come back in person on campus. So that process is in place and it's been streamlined and seems to be working well unless we get overwhelmed. The harder nut to crack is what happens when a student tests positive. We know where our employees are. We don't always know where our students are or where they've been. We have a duty to try to contact trace for our public health department for an infected individual. And as you can imagine, with a student, that's going to be extremely difficult. But what do you do as an instructor? A student says, or calls you or emails you and says, hey, I have been tested positive. And what you're going to do is you're going to want to reach out to your dean. Your dean's going to reach out to me. And we're going to work with that student to try to get as much information about who and how long they've been around people, whether or not they had close contact, whether or not they had close contact with the mask. And let me just define close contact for you all. A close contact means you have been within 6 feet of the index person, which is the infected person, for a cumulative time of 15 minutes over a 24-hour period. So you've been with a student for 5 minutes, you were really close to each other. Another 5 minutes later on the day, another 5 minutes later on the day, that you met your 15 minutes. If they were positive, then you now are a close contact. And what happens then depends on whether or not you're vaccinated. If you've been vaccinated, what we will ask you to do is just check yourself for COVID symptoms, but you may continue working. And this is all CDC guidance. We're not just making this stuff up. This is guidance from CDC, CDPH, and our local health department. If you are not vaccinated, you will have to quarantine for 14 days, just like at the very beginning of the pandemic. And so, again, this is why it's really great to be vaccinated because it gives you a lot more flexibility. It doesn't impact your students nearly as much. And all around, it's just a good thing. And with that, I think we can open up for questions. Did you want to come up here too, Keith, or do you want to?
We can rotate, yeah.
Yeah, okay.
Stretch out a little bit.
Sure.
So, yeah. Well, thank you, Darren, for that.
Yeah.
Yeah.
Okay.
My class is going to be face-to-face this coming semester, and we have approximately 30 students in our class. Our classroom is set up with tables approximately this size here at 3 per table in order to accommodate the 30 students. How is that going to work with if we have to go to distancing and things?
If we have to go to distancing, we're going to have to pivot back the way we did last March.
Dan, can you repeat the question?
Oh, I'm sorry. Yeah, thank you for reminding. The question was, I have a classroom that's got approximately 30 students. They're sitting in desks where they're approximately 3 per desk and probably about 3 feet apart, meaning that they're not socially distanced, which is okay for right now because that's the current guidance. What's going to happen if we have an outbreak? Did I capture that? Right, okay. And what's going to happen if we have an outbreak and we determine that we need to change course and revert back to distance learning? It's going to be very similar to what we did back in March of 2020. Maybe the only caveat is that we're better at it now. And again, I think as I indicated at the very beginning, flexibility and the ability to change and pivot as information changes, as the conditions on the ground change is going to be super important. Seth.
So just to piggyback on that, I have a class with very few students where we could easily social distance. If those regulations get put in place, is that what I do, just social distance, or?
Yes, the comment in question is an instructor has a class with very few students and they're able to social distance, should they? And the answer, I think, is yes.
I mean, if the new regulations come in where we're required to social distance, would I be able to keep meeting in person?
I think that's going to be dependent upon what the chancellor decides. My personal opinion, my view would be you guys, in particular in the sciences and the CTE programs, have been operating now for about a year in person and been doing so safely. And I would advocate that you can continue to do that, but ultimately that will not be my decision.
So actually, for the benefit of the people on Zoom, could you repeat his question? Just ask the question again. So they heard the answer, but they didn't hear your question.
I think you repeated the first part.
Okay.
The second part was just, if we got told to socially distance, would I be able to keep meeting?
Yes,
Possible.
thank you. So Seth Yates said, if we are told we have to social distance, and I'm already doing that, would we be able to continue meeting in person with our class? And that was my answer before. I would advocate for that. Ultimately, it's not my decision though.
And I can speak to that one really.
Go ahead, yeah.
Rob, before you ask your question. So in the situations like that, we would advocate as well that you continue to be able to meet face to face. Honestly, I would like to see the cases where you have your classes that are a little bit more tightly packed. Instead of going fully online, I'd like to see something a little bit more nuanced where we maybe bring in, is it a Monday, Wednesday, Friday class or Monday, Wednesday class?
Yeah, it's Tuesday, Friday.
Okay.
Tuesday through Friday.
Okay, so if we can bring in the students for, bring in batches of students, right? 10 at a time, one day each per week, so that they do get some direct contact. And then we have a more of a hybrid model. I think that's going to be something that we'd advocate for too. That will also take to the general membership and let you tell us what you think, because it will be more work for the instructor. But we all know from last March, or 2 Marches ago now, getting yanked back online was really a disaster for our students. So if we can have some kind of sustained hybrid situation that doesn't put our students at risk, that doesn't put us at risk, we're going to advocate for that. Okay, go ahead, Rob.
Well, in HVAC and also Wisha, training instructor, very familiar with the standards. So I've been invited to come back into my shop, which is essentially this big. Okay, not quite as tall. I have 2 huge roll-up doors. I have 100% ventilation through the back doors. We're positively ventilated, and we have cross ventilation in the shop structure. What part of the shop is in the shop, and what part of the shop is outside? We have orders that go. So I need to have the students, when they go outside, they're coming back in, mask up, and then
I think that the chancellor's statement I'm asking.
Wait, let's repeat the question.
I'm sorry, thank you for reminding me. We have an instructor that's teaching CTE classes.
Yeah.
He has a large warehouse-like laboratory space with roll-up doors, positive ventilation through a swamp cooler. And the question is, when my students go from the outside to the inside, do they mask up? And I think for right now, unless it is dangerous for them to do so, I think it's a prudent measure that we continue to do it, even though that environment I recognize is very, very safe. I just think we want to model the behavior in our students across our campus so that people don't become complacent in other areas. But I recognize that there are certain trades that wearing a mask might be dangerous for, getting caught in machinery or welding and such things like that. If that's the case, I've always been okay with them not wearing a mask in those scenarios.
Yeah, we actually put our face very close to moving equipment that has draw. Okay, and so if you have, loose items like this, goes right into machinery. And you can be pulled in.
I agree wholeheartedly. It's why I don't wear ties.
Right.
We have a problem with safety with the mask and the safety glasses. Because
Mhm. We've agreed, talking with Dr. Goldsmith, that, we understand that the rules that put out there were kind of a blanket universal rule, and that there might be exceptions based on the unique circumstances of particular instructional area. Okay.
So I have a question about the website that you for the homepage. I haven't been to it, but I've heard that there's a questionnaire that students need to self-attest to certain health guidelines, so for face-to-face. Is that there? That link? I'm sort of, yeah, that there. I do it once per semester.
Yeah, the question was pertaining to a student. It's basically a student contract, right? It's a student health questionnaire, and we developed that initially for our CTE programs and for our allied health programs. And in our reopening plan that Omar Gutierrez has put together, we are asking instructors to incorporate that as part of their syllabus if possible. And I think the link is there. If not, I will make sure I get it to you. Okay. Yeah. I know I prepared it for IT to put in there. I just haven't verified that it is.
Okay.
But we can get it to you no matter what.
One more question. Our classrooms have signs that say wear your masks or responsible.
The question is, will the classrooms have signs that say wear a mask? I talked to print services. They've printed over 200 signs that said masks required. I don't know that they're going to be posted on every classroom, but they're certainly going to be posted throughout the campus in prominent areas so that students understand that.
It is a good idea to put it in your syllabus.
Right.
Right. Until the regulation changes, put it in your syllabus. So just to have it on record. So we have two issues in the chat that I was hoping that you could speak to. It should be the last two comments. Are you able to access it? There we go. Okay. If we scroll up a little bit, yeah. If you could speak to the religious objection, and then there was, Lori, are you able to unmute and ask your question?
Yeah, it's more of a concern that even though we might be vaccinated, that we could bring the Delta variant home to children, especially young children. I have a 6-month-old at home that can't be vaccinated. And I've heard from a friend that works in the emergency room at Valley Children's that this is affecting children a lot differently than the Alpha variant did. I'm a counselor. We work in close proximity to students. So I'm just concerned. And I'm happy to wear a mask, happy to ask my student to wear a mask. But the social distancing part can be hard for us. So I was just kind of expressing my concern and also wondering what else can be done.
Yeah, that's a very good question, and it's a difficult question to answer, to be honest with you. I understand your concern 100%. I have the luxury of my children are adults and vaccinated, but I know a lot of people don't have that luxury.
I can speak to it.
You want to speak? Okay, and I'll just mention a couple of things. And then Keith would like to mention a few words as well. To the extent that you can socially distance, please try to do so. It just really increases the importance of wearing masks, not only for you, but also for the student that you might be seeing. Keith?
So for Lori and also for all of us that have elderly parents with whom you're perhaps in contact with or other immunocompromised people in your lives, please reach out to the union. We can work on an accommodation. We've had some good success so far with individual cases of flexibility with the administration. So if you come to me or if you come to Rhea Williams, who's the grievance VP for FCC's campus, we can help you. Okay, we're not going to be 100% successful in getting everybody to be able to work from home, right? But we do know that we have a lot more open office space right now. And so maybe it is possible for someone like Lori to be able to have her own private office for this semester. But we have to, there is a process, as we all know, the administration is slavishly attached to these processes, and for perhaps good reason. So we do have to go through them. So please reach out to me. I'll put my email and my phone number in the chat one more time. But just to encourage you, we have seen we've had some positive luck with this. Just today, we got a class converted to online. Just yesterday, got a class converted to synchronous online for the first couple of weeks because there's an immunocompromised person involved. So there is some compassion to be drawn upon here. Just let me know. And then if you could speak, Darren, to, I don't know if it's a legitimate question, but the religious mandate or the religious objection to masks.
Oh, yes. Thank you, Keith, and thank you for responding to that question as well. For those with religious objections or prohibitions of mask wearing, I encourage you to have their students work with student services, to have an interaction with the student, and to make that accommodation. Likewise, if a student has a medical concern or they're unable to wear a mask for a medical reason, I encourage you to work with student health services so they and or DSPS, depending on whether or not it's a disability accommodation versus a medical accommodation. Let me see, was there anything else in the chat there, Keith, that I missed?
Yeah, Matt Eastlass had a good question. Matt, could you just ask your question on mute? You can hear me if you ask him.
Hey, Matt, can you unmute?
Sorry.
Oh, thank you.
Trying to find the mute button is always hard. Yeah, so I've had students and faculty have kind of brought it up, that they're unable to receive the vaccine due to, immune compromise or just other health restrictions. What advice do you have for them, either in the work setting or social setting, so that we might be able to better answer some of those, at least on our end, especially in tutorial? I know that that'll help too. Thank you.
Great, thank you for the question. If it's an employee, the employee needs to work with their manager and go through the interactive process with HR to see if an accommodation is necessary or appropriate. And then again, as I mentioned earlier, if it's a student, they would either go through student health services or DSPS, depending on whether it's a disability accommodation or a medical accommodation. Does that answer your question?
Yes, thank you.
Thank you very much. Appreciate it. Good question.
Bernadette online. She can ask her question.
Bernadette, if you could unmute.
Yes,
Yeah.
I guess I just have more of a concern. You had said that if we were vaccinated and tested positive, that we could continue teaching. My concern is we already know that those individuals with breakthrough cases can still go and infect other people. And I guess that's also piggybacking off of the previous question about bringing that back home to people that we live with, but I'm just concerned about further spreading that with our students.
Thank you for the question. And let me clarify that if I misstated myself. If you are fully vaccinated and you are infected, then no, you have the same self-isolation requirement as anybody, regardless of your vaccine status. If you had a close contact and you're fully vaccinated, as long as you're not feeling ill, then you may continue to work. And that's just based on current CDC guidance and CDPH and Fresno Public Health Department guidance. I hope that answers your question.
Daniel has his hand up on Zoom.
Yes,
And-
thank you.
Thank you, Bernadette. And Daniel, if you could unmute and ask your question.
Yeah, there were more sort of like brass tacks pedagogical questions about, in my class, what can I and can't I do in terms of student interaction. So assuming everyone's masked, of course, can I have students, for example, do small group work? Can I have students pass papers to each other if they're going to read each other's assignments or something? Those sorts of things. What can I and can't I do that I'd normally do?
Yeah, that's a great question. And I don't know, I'll take a stab at it, and maybe Keith might want to put some input, have some input too, since he's an instructor. Right now, you would not be restricted to have them work in small groups. Of course, as we keep saying, they need to be masked. They may pass papers back and forth to each other. And did you want to add anything, Keith, to that?
Yeah. So just really quickly, and I know, Daniel, you're probably already thinking in this context, but it's just worth mentioning that we should keep in mind student comfort. So if they're not comfortable working in the small groups, I think we need to be a little bit more flexible. I know I do a lot of group work, and I'll take the pulse of my in-person class and see if they feel comfortable with that. If they don't, I'm going to have to get a little bit more varied in my delivery. So that's all I would say. And then I think Melinda, if you could unmute and ask your question.
Thank you, Keith.
It's one for you.
Thank you. So I'm wondering, what about the rest of the students in the class and protocol if a positive student sat in the class, since that would obviously be more than 15 minutes of exposure? Does the whole class, for example, have to quarantine?
No, in this, I'll just make a comment about the importance of taking attendance so that we know who's been in your class. But the people that would need to be notified of a quarantine requirement would be those that were within 6 feet of that student. That's going to be a real challenge. I mentioned it earlier on in my presentation that we're going to kind of muddle ourselves through this with the students, because they go all over the place, right? And so the answer is no. We probably would not quarantine the entire class. It would just be those people that were within direct proximity, and only if they were unvaccinated.
So would you recommend assigned seating in the interim time for some?
Yeah, I mean, I think assigned seating, it's not my place to tell you to do assigned seating, but I think it is helpful. I really do. Did you want to add to that?
Yeah. Well, I'm not a fan of assigned seating, but I do agree. Yeah, I hate having it, but it makes sense this time. So David Balo had a question that keeps coming back up. Oh, I'm sorry. One question from the group here.
Seating, would it make sense to see, I guess you don't know the vaccine status of students, but
Yeah, it's unfortunate that we cannot, well, we can ask, we just can't require, and it's bad form to ask a student's vaccine status. If you find yourself in a position where they volunteer that information publicly, wonderful. If they volunteer it only to you, please do not divulge it to anyone else. Okay, just keep yourself out of trouble.
Yes, a vaccine record is a medical record and is protected by HIPAA. We had a question on the line here. Is that
Yeah,
right?
from David Balo.
Oh, David, if you could unmute and ask your question.
Sure. It's about verifying that somebody does have a valid exemption. When we have a DSPNS accommodation for, say, extra time or different testing atmosphere, we get that from DSPS and we know it's been vetted. So what is the mechanism, or what are the plans for a mechanism to have a similar process for someone who doesn't wear a mask in their classes?
I honestly don't know the answer to that, Dave. I would have to follow up with Student Health Services and DSPS and perhaps Student Services to get back to you on that answer. Some of the stuff.
Appreciate it, because a lot of us are wondering, how do we know? The student walks in and says, well, I have a religious exemption or I have a medical exemption. We get in big trouble for making any kind of accommodation if we don't have the paperwork for DSPS. So
well,
similar idea.
David, they do have to have documentation. So somebody can't just walk in and say, I object on whatever grounds to wearing the mask or being vaccinated or whatever. They have to have documentation. Now we can work on getting a formalized process so that there's a single source for that. But I think we're all familiar with accommodation letters that have been let's say doctored, or just ginned up by a student. So
false accommodation.
Those are not legit. And we can ignore those. And I would say for right now, until we have a steady process, an actual process set in place, send them to Student Services. If you have somebody who objects on those grounds and doesn't have proper documentation, they need to go to Student Services.
And then should we at least expect an email from Student Services?
Yes, and the question from Seth is, should we expect at least an email from student services? Absolutely, yes, there should be documentation. In fact, there needs to be. So otherwise, exactly what David said, right? We could get in trouble for accommodating somebody irregularly. So, any questions from the room? Yeah, Rebecca.
Yeah, so our team going to ask this question, but I feel like it's a thorough book. We're totally here, but if a student comes to the classroom and is not wearing a mask, or you can keep their mask on, or they come in with symptoms, tell them they have to leave.
Yes, you have the right to do that. The question was, if a student shows up to class without a mask, refuses to wear a mask, or is expressing symptoms, can we, as instructors, ask them to leave? And yes, you have the right to do that. And it falls under this, basically it's a student code of conduct issue.
And then just one other quick question. So hopefully this doesn't happen in your thoughts, but if we do have to test positive and we have to quarantine, this is more of a, we still have that, like, wasn't there something about time off? If you're positive, that's still.
Yeah, the question is, if you test positive, let's just, regardless of whether or not you've had a vaccine, and you're asked to self-isolate for the isolation period, is there COVID time off leave for that? And there is through the end of September.
Mm-hmm.
We don't know if that's going to be extended. I'm trying to remember, I think you get 80 hours
Yeah,
and
it's the equivalent of 10 work days.
10 work days, yes.
Yeah.
And so, yes, at least for now, and they've already extended it once, so perhaps it'll be extended again. I just don't know.
Mm-hmm.
Great question, though.
I would say that it's likely to be extended. So
if the student tells us that they're positive, are they protected by HIPAA laws? Because we need to report it to the dean. Would we get in trouble for that?
No, and the reason being is that it is a HIPAA issue, but some of those things take a back seat to pandemic crisis, if you will. So you would not be in trouble for identifying or notifying your dean. And it'd be a confidential conversation between you and your dean, and they'd probably be bringing me in as well. Thank you.
On a related note, like, if the student does sit in the classroom positive and we find out later after class that they were positive, so they had close contact with students around them, who tells those students around them that they need to start self-isolating if they're unvaccinated? Is it me? Is it on team? Because we have class a couple times a week, and I'm not sure, like, the timeline for getting those students to not be in class.
Very good question. I'll repeat the question. The question is, if you have a student who's been in your class, has then reported to you that they tested positive, who's responsible for identifying the close contacts and notifying them? And we've had this happen before, so we know how to proceed. It's a little bit messy, but we work with you and the dean and myself. And typically the notification is going to come from the campus. And in the past, it's come from the dean to the classroom. And then to the individual students that we know best, that have been around the positive student.
Is it a fast process, or will those students like not know for like 5 days?
We try to do it within a day or two at the most. What's yet to, what we don't really know is what's going to happen if we get overrun with positive cases. I think that would be sort of an inflection point in how we decide to operate our schools.
From Zoom, we had Anna, then David, then Jerry, and I believe Julie after that. So Anna first.
Anna, if you could unmute and ask your question.
Yes, earlier it was mentioned that Sean Henderson was a point person for student services. Would you happen to know who the point person for DSPNS is?
Be the director.
Probably Susan. Yeah.
Yeah, you want
Susan Ariola.
Thank you.
next?
David.
David, if you could unmute and ask your question, please.
Okay, I am going to be working in the worst possible scenario as far as social distancing is computer repair and how that works. I'm limited on the size of the classroom and equipment. 2 students are assigned to work on a computer, so that computer will be there for the whole semester. But what if I run into a scenario that somebody has a waiver, legitimate waiver, that they can't wear a mask, but nobody feels comfortable being their partner?
That's a tough one.
And so the question is then, do we have available inventory to have that person separated from the group? Is that a possibility, David?
The only way I could do that, there is an adjoining class next door, and I don't know if it's being used. I would have to send them during the lab portion, send them next door with their own computer to do it.
Yeah. And I think that's what you would have to do. So I would follow up with your dean. It's Becky, right?
Correct.
Yeah. Follow up with her and then copy me on it, please, because I'm curious how she responds. It shouldn't be a space issue. And we have the funding. This is an important thing for everybody to know. We have a lot of money left over from the HERF and CARES funds to address a lot of these instructional and inventory issues. A lot. Okay. And so much so that Omar Gutierrez is actually asking for ideas on how to spend it related to COVID. So David's scenario is a perfect example of that. Okay.
Yeah.
Thank you.
Good question and hard answers. And we don't have all the answers, and we're going to be kind of learning as we go at some level.
Yeah.
And great. Thank you for bringing up what Omar said yesterday in convocation, because one of the questions I get a lot is, can I wear a face shield instead of a mask in the classroom? And the answer is no, because face shields don't block respiratory aerosols. But there are clear face masks out there now that have been designed and developed specifically for the hearing impaired, for teachers teaching things like speech, where it's very important to see the mouth movements and the structure. And that, I think, would be a great use of some of those funds that you're referring to.
Yeah.
So if that is something that was useful for you, please let Omar know. So I would love to see him purchase a few thousand of those.
Yeah, I would too. In fact, I was unaware of that technology. I was unaware that those existed. So we were advocating for face shields for our ASL and EMLS instructors. But if we have clear face masks that are available and can be distributed, that's wonderful.
I will send you a link so that you can bring it up to Flagpole.
Thank you. I appreciate that. I think Jerry was next.
Yeah, I put my question in the chat, but I do have a comment, and I hope my comment does not offend anybody, because it's not meant to be offensive. However, it is meant to bring issue to the fact that perhaps students may have some issues with the wearing of the mask, and the instructors may have to report them. And I would just ask, this is my personal plea, it's based on social justice issue, it's based on the jail system, it's based on who are put away, it's based on a lot of things for me that, you know, I don't want it to be like in New York and other places where African Americans were the first picked on. They were the first to be, you know, rustled to the floor and that kind of thing. I'm not saying that our faculty will do that at all. I'm just saying historically, so that I ask that we reserve patience and any feelings that we have about students, and in particular African American students. That's an issue for me because I'm the mother of 2 African Americans. So I don't expect anybody else to understand my plight. So that is one concern. And then my other concern is in the chat. The question I have is in the chat, because I don't really remember what I said in the chat. I can't recall everything I put in the chat that I asked. You could just read it out if you like.
We'll look for it, Jerry. Let me address your comment, Donut. Thank you very much for that comment, because it's very important. Dr. Goldsmith has been very clear about this. We want to show our students grace. We want to work with them. We want to have patience with them. We are not going to be the sledgehammer. We're going to be the velvet hammer. So please keep that in mind as you have perhaps an occasional student that doesn't want to wear a mask. Let's work with them. I mean, we're here for them, right? So that would be, I guess, the best way I could address your concern, Jerry. I do appreciate that. We will look for your other comment. I don't see it off the top of my head.
I think it was the question, I can summarize it really quick, like I remember. I think counselors have a lot of questions, and I think we have layers of questions that have gone unanswered. But I know Saturday we worked with over 400 students, and I sat for 6 hours next to a person, though I and the student were in a theater together, and we worked from home. We had robust numbers as reported on opening day. Yet and still, counselors who have little children and other people who are at risk having to be forced to go back to work. And we've done an excellent job as reflected in the quantitative data, the VPSS report. Can we have a clear plan on how we're to roll back? Because the CDC has been unclear. Our chancellor's office has been unclear. The health department is unclear. And if everybody is unclear, how do they expect us as counselors to be clear? And I can guarantee you, no counselors will stand up the way I do. It's a refreshing feeling when you know you're near the end of your road with work. You can say the things you need to say. And I think I'm speaking for a lot of the counselors that I think we're being ushered back in, and we object to being ushered in. And I'm not speaking for everybody. I'm speaking on the basis of what I know.
Yeah. No, and Jerry, you're absolutely right so the district has not done a good job on this. And in fact, we were really hoping for a definitive stance from the chancellor at the last board meeting, and he just punted it. He said, I'm letting the college presidents handle this. And so now we're hearing that counselors at Reedley College only have to come in 1 day a week, where counselors here at FCC and at Clovis are having to come in 4 to 5 days a week. So we're working on an MOU with the district, with HR. We met with them. I can't even remember what day it is now. We met with them on Wednesday. We're supposed to have an answer very soon that allows non-instructional faculty to work from home as much as possible. So there may still be some direct face-to-face interaction, but not nearly as much. And one of the ways that we're trying to present this is just simple apples to apples. Well, if Reedley's counselors can work from home 4 days out of 5, so can FCC.
Okay, and let me just jump in here and say, counselors at FCC have the most contact, and our monies are shared with everybody. And I really want to thank our new department chair, Janine, for ushering us through this process and through the things we've been going through, because I don't think if we didn't have her this semester, I think I'd be on the floor somewhere laying down trying to do my work because I'd be so stressed out. And after our meeting yesterday, I just felt our counselors were so stressed. I'm not accusing them of being stressed. I'm saying they appear to be stressed. And I just want to let everybody know that Janine has been, it's been a lot of stability coming from our department chair in the aspect on what we need to do.
Oh, that's good to hear. Yeah. Okay, so we have Loretta, then Melinda, then Farouz.
Hi. I put my question in the chat, but I'm just going to open it up. Not all of the issues, but many of the issues would be solved if we were a district that required vaccines for students, staff, faculty across the board. So am I correct in assuming that this is within the purview of the board?
Yes.
Yes. Okay.
The board and the chancellor.
The board. Okay. So if that's the case, would it then be helpful if we as faculty and staff would encourage our loved ones, our families, friends, et cetera, to contact their individual board members and ask for a vaccine mandate? Would that be helpful?
Absolutely. Absolutely. You should always avail yourself of the democratic process. So it is important to know that important to always remember our board of trustees are elected officials and they only have one employee, the chancellor. I'll just let that sit. So always contact them. And if you're curious about who your actual trustee, who your area trustee is, send me an email. I will give you their contact information and you can reach out to them directly. As to a vaccine mandate, so we as SCFT have been asked to consider this, and we will be meeting later in the month to consider a stance. That's as far as I'm going to go without involving the executive council and the direct general membership. So this kind of a decision cannot be dictatorial. It's going to be very, very democratic in nature, but we will be considering a stance. Now, I did not say considering a mandate. We're considering a stance on the mandate. Given what we've seen so far with this chancellor, I don't want to get you in trouble. I don't think he's going to be in favor of a mandate. That doesn't mean that the board couldn't compel him. So that's where we are with that, I'd say. Does that answer your question, Loretta?
Yeah, that does answer my question. And I'm just curious, has faculty and staff, have we been polled? I haven't received any kind of, and I don't know what would be the appropriate entity to actually do that, but
So
that might be additional evidence necessary.
The staff are being polled. Ernie, am I right today?
Yes, yeah, survey went out this morning.
Yeah, survey went out to classified staff today. We surveyed people informally by text a couple of weeks ago. We'll do that again more formally in this next week.
Okay, thank you.
Yeah, Melinda, then Firuz.
If a student shows up to class and tells us at the start of class, not any time earlier than that, that they tested positive, I assume the protocol would be that we would tell them they'll need to skip class that day, and then would we tell them to contact us regarding when they'll be able to return? Or what would be the protocol for that?
Yeah, you would cancel them. In fact, I think we're going to be having some more communications to go out. But you would counsel them to leave and go home or wherever they reside, and then to self-isolate for 10 days. And then they may come back on the 11th day, provided that their symptoms have resolved, if they had symptoms, and that they have not had a fever for the last 24 hours. Does that answer your question, Melinda?
Yes, thank you.
Okay, thank you. Good question. And then Firuz?
Hello, everyone. And I want to thank Dr. Santos for raising her voice and share our concerns. But I also want to add that our cubicles and our offices are very, very small and confined. So we are asked to come in at least 2 days per week and see students. We don't have Zoom to Zoom students. And also when students are coming in, we cannot ask if they are vaccinated. We are not checking their temperature. There is no safety measure put for safety of the counselors and their families. So I wanted to know, Darren, what do you suggest that we need to do or the campus has to do for ensuring our safety? And if basically, is there anything that we can do personally?
Well, personally is wear your PPE, obviously. But we do have, through Omar's office, basically it's a student contract. It's contract with the lower C, if you will. But it's a contract that we have our students sign that say, I'm not positive. I don't have the following symptoms. And they attest to that. And that's basically the best we can do right now. There's really no other way to know definitively in a practical sense the status of a student. And that's, again, this is just one of the real true challenges of all of this. And not a good answer. I recognize that. It's just that's just the cards we have to play right now. Do you want to answer that?
Yeah, Firuz, let me talk to the district or well, talk to the president, since it seems to be the more direct path right now, about getting somebody at the door in general counseling to take temperatures. What do you think about that?
I think it's a partial solution. Yep.
Okay, so that would help at least a little bit. And then my question about the form, the contract that they're self-attesting, how do students who are going to counselors have access to that? So I understand classroom wise, right?
Yeah, I'm just trying to think of a practical way to provide that to them. It could be that when a student, are students currently scheduling a counseling session?
Yes.
So maybe when they schedule, the counselor can then provide them with that form and they fill it out in advance of them showing up.
Okay. Firuz, did you hear that?
Yes, our biggest concern, our biggest concern is for next week as students are rushing in campus. And how are we going to serve them, see them as we stay safe?
Right.
You know, it is very complicated at this point.
I'll make some calls as soon as this meeting is over. and see if I can get some positive answers for you. So I think we have time for one more question.
One or two.
Maybe two.
Just we have about 5 minutes.
Okay, so Bob Schmully.
Yeah, I'm trying to work around this concept of working with a student that doesn't want to wear a mask. I mean, I'm assuming the whole point of the mask is to prevent infections in class. So, I mean, what exactly would be working with a student other than asking them to leave immediately if they refuse to wear a mask? I mean, I'm not quite clear about the concept. So if you could further define that for me, I would appreciate it.
Yeah, and I think you're referencing back to Jerry's comment, right, of being compassionate. I think if I can dovetail off of what Jerry was saying, what we're suggesting that you do is not immediately send it to the Dean of Student Services, right? Not immediately be punitive. Try to talk to the student and explain to them that they have to do this, that it's in their best interest and ours. And then if they're still resistant and they need to be forwarded to discipline, then sure, absolutely.
Okay, but in all cases, you would still ask them to leave.
Yes, absolutely. Yeah, no, they don't get to stay if they don't want to wear a mask. If they don't have a documented reason, medically documented reason for not having it.
So it's simply being punitive, not to be punitive if you insist that they leave, other than the fact that you're insisting that they leave.
Yes, not to be immediately punitive.
Okay.
Okay, Matt, and then we'll finish with Joellen.
Thank you. I just wanted to bring up, I know we've talked a lot about mentioning that students, wouldn't necessarily be advised to go to class in the event that they are test positive or they exhibit symptoms. I just also want to point out that in the event that students, they are not able to go to class, I can guarantee that most of them will seek out tutorial services as a supplement to that. So if I can just at least put it on everyone's radar, I know we have to kind of be delicate with that. This actually just got brought up to my mind when we were talking about advising counselors. I know it's very difficult to share that information across different bodies of people in different areas, but I would hope that tutorial does not get lost in being notified. If a student, if that knowledge can at least come to the coordinators of our programs, I've always worked with, confidentiality and everything else like that. But I do want to just put it on everyone's radar that has come up in the past where students may not be able to go to class for whatever reason. We have had that where students will come to tutorial. So I would ask, please don't forget about tutorial. Thank you.
Absolutely. Thanks, Matt. Okay, last question, Joellen, and just really quickly, Tiffany, I do see your comment, and I'll circle back with you.
I had a question. I am planning to have a Zoom session at the same time that I have an in-person session. So if they didn't want to wear a mask, would it be okay to ask them to come to class via Zoom?
That's entirely at your discretion. Yes, you can do that. What I would be careful with is if any other student is in the camera while you're Zooming, make sure that you keep tight control of that recording, right? Only the students in that class and you should have access to it. Otherwise, it's a FERPA violation.
So for example, you can't have a Zoom session in your classroom and post it in your online class, or 100% online class?
So you can have a Zoom session in your class, but you cannot post it to another class. Even if it's the same subject, they don't cross list like that.
Okay.
Does that make sense?
Yeah, no, but yeah, I understand.
Yeah. It's an unfortunate regulation, but yes, if it's just you on camera, you can do that.
So if you edit out any students asking any particular questions?
Yes, yeah, you can do that.
Okay, thank you.
Okay.
All right.
Thank you all very much. I really appreciate your time, your thoughtful questions. And I know that many of these questions are very difficult to answer.
Yes.
And we are in uncharted territory, and I'm glad that we all recognize that. But hopefully we've got some things cleared up for you. And Keith, I sure appreciate you helping me present this today. I'm really, really grateful.
Likewise. Thank you. Thank you.
Thank you all.